Health Organization, WHO, announced on Wednesday that the rapid spread of monkeypox, also known as mpox, in Africa constitutes a global health emergency. The WHO warned that the virus has the potential to cross international borders, similar to what occurred with the COVID-19 pandemic. This declaration was made by WHO Director General Tedros Adhanom Ghebreyesus following a meeting of the UN Health Agency's Emergency Committee. Additionally, the Centers for Disease Control and Prevention Africa, CDC Africa, issued a statement on Tuesday declaring monkeypox a public health emergency across the continent. This outbreak underscores the need for a coordinated global response to prevent further spread and mitigate the potential worldwide impact of this virus. The World Health Organization, WHO, reported that so far this year, over 14,000 cases of monkeypox and 524 deaths have been recorded in Africa, surpassing last year's figures. Most of these cases, over 96%, have occurred in a single country, the Democratic Republic of the Congo. This concentration of cases has raised significant concern among scientists, who fear the emergence of a new variant of the disease. This variant of the virus may have the ability to spread more easily among people, increasing the risk of a more severe health crisis. The scientific community is on high alert and continues to closely monitor the situation to better understand the characteristics of this potential new variant and to develop effective strategies to prevent its spread to other regions, thus avoiding a situation similar to the one faced with the COVID-19 pandemic. Scientists are increasingly concerned about the potential spread of a new variant of monkeypox, a disease that could transmit more easily among people. Given this worrying possibility, it is crucial to understand what monkeypox is and what measures could be taken to halt its advance. Monkeypox was first identified in 1958 by a team of scientists who observed outbreaks of a smallpox-like illness in monkeys. For many years, human cases were relatively rare and mainly concentrated in Central and West Africa, where people had close contact with infected animals. However, with the recent spread of the virus and the possibility of a more contagious new variant, the scientific community is focused on developing strategies to contain its spread and prevent a global outbreak. Knowledge and active surveillance are crucial to preventing this disease from becoming a greater international threat. In 2022, it was confirmed for the first time that the monkeypox virus could be transmitted sexually, leading to outbreaks in over 70 countries that had never previously reported cases of this disease. This new mode of transmission has heightened concerns about the virus's potential for more rapid and widespread spread, prompting a renewed focus on global surveillance and control measures. Monkeypox belongs to the same virus family as smallpox, but fortunately, it generally causes milder symptoms. Common symptoms include fever, chills, and body aches. However, in more severe cases, individuals can develop painful lesions on the face, hands, chest, and genitals, which can lead to more serious complications if not treated properly. Early identification and isolation of cases remain crucial for containing the spread of this virus. The situation in Africa has raised significant concern due to the drastic increase in monkeypox cases. According to the Centers for Disease Control and Prevention Africa, last week it was reported that the virus has been detected in at least 13 African countries. Compared to the same period last year, cases have increased by 160%, and deaths have risen by 19%, highlighting the severity of the situation. A few months ago, scientists discovered a new form of monkeypox in a mining area of the Democratic Republic of the Congo. This variant has a fatality rate of up to 10% and could spread more easily among people. This development has heightened the alert level, as it could lead to a more severe public health crisis if not controlled in time. Vigilance and a rapid response are now more crucial than ever to prevent further spread of the virus. Unlike previous outbreaks of monkeypox, where lesions primarily appeared on the chest, hands, and feet, the new variant is causing less severe symptoms and lesions in the genital area. This atypical presentation makes the disease harder to detect, increasing the risk that individuals may transmit the virus without knowing they are infected. The World Health Organization, WHO, reported that, for the first time, monkeypox has been detected in 4 East African countries: Burundi, Kenya, Rwanda, and Uganda. All these outbreaks are linked to the epidemic in the Democratic Republic of the Congo, indicating a troubling spread of the virus in the region. WHO Director General Tedros Adhanom Ghebreyesus expressed concern about the possibility of the disease spreading further both within and beyond Africa, emphasizing the need for ongoing surveillance and stricter preventive measures to contain its spread. In Côte d'Ivoire and South Africa, health authorities have reported outbreaks of a different and less dangerous version of monkeypox, similar to the one that spread globally in 2022. While this variant is less severe, it remains a concern, especially given the expansion of more lethal forms of the virus in Africa. The World Health Organization, WHO, emergency declaration aims to mobilize donors and countries to take urgent action. However, the global response to previous declarations has been uneven, raising concerns about the effectiveness of this strategy in mobilizing resources and international attention. The Director General of the Centers for Disease Control and Prevention Africa, CDC Africa, Dr. Jean Cassia, explained that the emergency declaration aims to mobilize our institutions, our collective will, and our resources to act quickly and decisively. He also called on international partners to provide support, noting that the increase in cases on the continent has largely been ignored. This situation underscores the need for coordinated action and international support to contain the spread of the virus. Current control strategies are clearly failing, and there is an evident need for more resources, said Michael Marks, a professor of medicine at the London School of Hygiene and Tropical Medicine. If a global emergency declaration is the mechanism to unlock these things, then it is justified, he stated. The main difference between the current monkeypox outbreak in Africa and the global epidemic of 2022 lies in the affected populations and how the virus spreads. During the 2022 outbreak, most cases were among gay and bisexual men, with the virus spreading primarily through close contact, including sexual relations. In contrast, the current outbreak in Africa shows a different and more alarming pattern. Now, children under 15 represent over 70% of monkeypox cases and 85% of deaths in the Democratic Republic of the Congo. This shift in the affected demographic has heightened concern, as it indicates the virus is disproportionately impacting the vulnerable child population in an already fragile region. Additionally, the increased fatality and emergence of new virus variants in Africa make this outbreak especially dangerous, underscoring the need for an urgent and coordinated response to prevent an even greater public health crisis. Before the emergency meeting, Tedros Adhanom Ghebreyesus, WHO Director General, highlighted that officials were dealing with multiple monkeypox outbreaks in different countries, each with different modes of transmission and varying levels of risk. He emphasized that stopping these outbreaks will require a comprehensive and tailored response to address the diverse circumstances and challenges in each affected region. Greg Ram, director of Save the Children in the Democratic Republic of the Congo, expressed particular concern about the spread of monkeypox in the overcrowded refugee camps in the eastern part of the country. He noted that around 345,000 children live, crowded in tents and unsanitary conditions, making them extremely vulnerable to the disease. Ram also mentioned that the country's healthcare system was already collapsing under the pressure of other severe health issues, such as malnutrition, measles, and cholera. The combination of these factors creates an environment where monkeypox could have devastating effects if swift and effective measures are not taken. Dr. Boguma Taitanji, an infectious disease expert at Emory University, has indicated that it is still unclear why children are being disproportionately affected by monkeypox in the Democratic Republic of the Congo. She suggests that the increased susceptibility of children to the virus could be a possible explanation. Additionally, Taitanji proposes that social factors, such as overcrowding in refugee camps and exposure to parents who contracted the disease, may be contributing to this trend. The lack of definitive information on these causes highlights the need for further investigation to better understand the dynamics of the outbreak and develop effective strategies to protect vulnerable populations. To curb the spread of monkeypox, several measures can be taken based on the experience from the 2022 outbreak and current conditions. 1. Vaccination and treatments. During the 2022 outbreak, the use of vaccines and treatments in wealthy countries was crucial in controlling the virus. However, in Africa, access to vaccines and treatments has been limited. Increasing access to specific monkeypox vaccines and antiviral treatments in affected regions could help manage the outbreak. 2. Vaccination against smallpox. According to marks from the London School of Hygiene and Tropical Medicine, immunization with smallpox vaccines, or related virus, might also be beneficial. Since smallpox and monkeypox are related, smallpox vaccines may provide cross-protection. 3. Prevention measures and education. Educating communities about disease prevention, including avoiding contact with infected individuals and promoting proper hygiene, is crucial. Raising awareness about risk behaviors can help reduce transmission. 4. Improving sanitary conditions. Addressing overcrowding and unsanitary conditions in refugee camps and affected communities can reduce transmission. Improving sanitation infrastructure and providing adequate medical care are essential steps. 5. Surveillance and rapid response. Implementing robust surveillance systems to detect early cases and respond swiftly to outbreaks can help contain the disease before it spreads widely. These combined strategies can be effective in reducing the spread of monkeypox and mitigating the impact of outbreaks in affected regions. To control the spread of monkeypox, a significant supply of vaccines is needed to immunize high-risk populations, including sex workers, children, and adults living in areas with active outbreaks. Dr. Boguma Taitanji emphasized the importance of vaccinating these groups to prevent further expansion of the virus. The Democratic Republic of the Congo has begun negotiations with donors to secure vaccine donations and has received some financial support from the United Kingdom and the United States. This support is crucial for providing the necessary resources to combat the outbreak and protect vulnerable communities. International collaboration and adequate vaccine supplies are essential to curb the spread of the disease and prevent a more severe public health crisis. The WHO has already allocated $1.45 million from its emergency fund to contribute to the monkeypox response in Africa, but has indicated that an initial $15 million is needed to fully finance this response.
Top News. Give it a like and subscribe.